Good morning. Thank you for your attention and participation. I'm trying to wean off of some coffee a little bit, so excuse my jitters if I have any. So as Dr. Isham stated, I am Dr. Torrie Harris, and I'm the Division Director for Community Health at the Louisiana Public Health Institute. We're a little different than a governmental health department. Well, we're actually a lot different, but we do serve supporting roles to health departments, and so I will spend some time explaining to you what a public health institute is, and then also talking about, as we discussed in the first panel, how we've translated much of the work that we've researched and put that in, implemented it into community programs and statewide programs. Also, I wanted to make the statement that over the last 16 years of my public health career as a practitioner, I've addressed health equity and health disparities. And in the field of health equity, we see health literacy as a methodology to addressing health disparities and achieving health equity. So in the map earlier, when we saw many states not complying with the survey, I would suspect that many of the health literacy activities that are occurring in some of these states happen in their offices of health equity or perhaps in their offices of minority health. Every state, just about every state, receives funding from the CDC or HHS to focus on health equity issues. And I previously was the director for health equity in the state of Kentucky. We receive funding to focus on how do we address populations that are typically underserved. And in the state of Kentucky, that also meant rural Appalachian populations as well, not only racial and ethnic populations. So if you did the survey again, you might ask that question about health equity. Also, I would address the question about the Public Health Accreditation Board. I think if you look in those standards, you would see that there is a standard, I think standard number 3, that focuses on cultural and linguistic competency, and that's probably the closest you'll get to a poignant or direct approach to health literacy. So it may not be explicit as health literacy, but more addressed under cultural and linguistic competency. So a public health institute, or a PHI as I'll refer to it in this presentation, is a nonprofit organization. And their focus is to improve public health outcomes for fostering innovation, leveraging resources, and building partnerships. There are about 37 public health institutes across the nation. Ours is one of the oldest. Our CEO, Joe Kimbrell, started the Louisiana Public Health Institute, as well as our sister organization, the National Network of Public Health Institutes. And there are many public health institutes growing as a part of that initiative. And I'll show you in which states there are public health institutes. So our role as public health institutes are fiscal and administrative management. I know if you've ever worked with a public health department, you can often find that there's a lot of bureaucracy, and it takes a long time to get grants and contracts fulfilled and things of that nature. But in being a nonprofit organization, typically small, our health department in the state of Louisiana actually grants us money to hire for them because it's just easier to do that. So that's one of the roles we play, but we also play the role in convening and facilitating community meetings, training and technical assistance, and we play a large role in our health institute in health policy. Not all are the same, but they all typically have similar competencies that are very similar to the essential services of public health. The NNPHI, which is the national network, is a body that convenes all of the institutes together to talk about current health issues. It was started with funding in 2001 from the CDC and Robert Wood Johnson, and we have now 37. We have some provisional and developmental health institutes, which are just starting or just getting off the ground. They're listed in these states. And then we have 6 affiliate members who don't necessarily address the same competencies, but are affiliate partners. So the Louisiana Public Health Institute is a 501c3, as I stated. It was founded in 1997. It is based in New Orleans, and our mission incorporates health equity into our principles. And it is technically to promote and improve health and quality of life through diverse public-private partnerships with government, foundations, academia, community groups, and private businesses. And we have parishes in Louisiana. That's a part of our Catholic roots, but they are equivalent to what a county is. So what I'm going to do is just describe to you some of the programs that we have at LPHI, which we call it, and I'll weave in some components of what we do in terms of health literacy so you can have an understanding. But I will end off my presentation by giving you an actual example of how we use health literacy. So we have two main divisions, one of which is health systems, and then we have community health, which is the division I oversee. In health systems, we recently, we didn't recently because the grant has now ended, but we did receive funding from CMS to do a Beacon Community Project. And that project was for health information exchange. We developed a health information exchange in the city of New Orleans for medical or health information. We also have a primary care and behavioral health programs. The behavioral health program, we receive funding from Johnson & Johnson to integrate mental health services into primary care clinics across the city. The adolescent and school health program, which sits under the health systems program, is called School Health Connections. That funding was received from the Kellogg Foundation, and what we do is we give schools funding, which they apply for through an RFP to hire a school health coordinator. The school health coordinator is a part of the staff. We give the school the funding, and then gradually, after 3 years, the school is responsible for finding a sustainable financial methodology for paying the school health coordinator. The school health coordinator sits in the school and helps to run the programs of the school. So there you could imagine it's really important to understand what the school population needs in terms of health. Also, a part of that, there's to start a school-based health coalition in conjunction with the communities there. And together they work on health issues that are pertinent to their surrounding area. There's also the For Real Health Teen Pregnancy Prevention Project, where we're training youth during summer programs to understand about sexual health. In the state of Louisiana, teaching about sexual health is against the law. So, however, we have the second highest rate of HIV. So there are a lot of political issues that we have to navigate because of that, and the way we get around that is by teaching the kids about it in summer programs as a part of Job Corps. Also, we have HIV, AIDS, and STDs and reproductive health section. I'll talk to you about that later because that's one of the examples that we're giving. And then in my division, community health, I have a number of programs. We have the Louisiana Campaign for Tobacco-Free Living, which I'll give an example for you about that. We have our Fit NOLA project. Our government, our state government, has given everyone the mission of becoming the healthiest, or one of the healthiest states in the nation, to the level of number 18, but we are currently number 50 as of this year. So there's a disparity in thought of how quick we can get there and what all of that means. So we do work with our government partners to make them understand how we can do that and support their activities in any way. Through the Fit NOLA project, our mayor and our health commissioner came up with an idea of engaging non-traditional partners, business community, in a steering committee to focus on physical activity and obesity in our city. You know, New Orleans is very well known for our food and party and lavish drinking, but it also has its consequences in obesity. Then we also have a lot of barriers in terms of we have natural disasters, it rains a lot, especially during hurricane season, so many people opt not to exercise outdoors. So this project complements that in that we received money from Blue Cross Blue Shield to do a challenge grant. They funded communities across the state to do similar projects to focus on physical activity and obesity. And so we are working with our community health clinic, our university, Tulane University, a farmer's market, the police department, and a number of other organizations to offer fruit and veggie prescriptions, which the doctor is going to offer to diabetic patients in their support groups, where they can go match their money at the farmer's market, so they get double their money. In addition, we're working with the New Orleans Recreation and Development Commission to enhance the built environment of the parks that are located in low-income neighborhoods. And they're going to offer new infrastructure based on community input. So that we took some surveys of the communities that live in those neighborhoods and asked them what kind of physical activity programming they wanted, in addition to what kind of built equipment they wanted in their park. And we actually have our kickoff on Saturday, pending it doesn't rain. Also, we have our Healthy Communities portfolio, which, as my colleague showed an example of mapping, we have a site called healthynola.org, where it maps communities. After the Hurricane Katrina, New Orleans became really big on its neighborhoods, and I learned after moving back there that we actually have 72 neighborhoods. I was commenting to someone earlier, when I grew up there, it was more about you lived uptown, downtown, mid-city. Now, you identify by which neighborhood you live in. So we map the neighborhoods to determine health outcomes in those different neighborhoods. And we use neighborhood liaisons to help people navigate the website and determine if the information on there was correct and what they needed on there to understand the site. I think what we learned is we gave them too much data and they didn't want that much. They wanted as little data as possible, but the point of it was to empower them to use the data to make a difference in their own neighborhood. We also do bike and pedestrian safety. We have a bike and pedestrian civil engineer who works for our agency, but sits in the Department of Public Works. So she works with those people to talk to them about health and how to make infrastructure of the built environment comparable with health. So we have a number of bike lanes in our community, and what we've learned, if you want to talk about health literacy, is that some people are not happy with the bike lanes because they find that they interfere with their driving. So we're developing a campaign to examine the importance or display the importance of riding your bike safely and not interfering with that, and then also health education for drivers on how to avoid an accident or to be aware of bikers. And then we also have our Center for Community Capacity, where we offer technical assistance trainings to our community members as well as our stakeholders. The final project I'll talk to you about is the Gulf Region Health Outreach Primary Care Capacity Project. We received funding from the BP medical settlement. You know, we had an oil spill, a really huge one that affected most of the Gulf Coast pretty harshly and severely. So our role in it is to enhance primary care capacity, and specifically, we're focusing on FQHCs throughout the Gulf Coast, not only in Louisiana, but in Mississippi, Alabama, and Florida. And we're offering them funding to improve their HIE systems, to hire mental health specialists, whatever their need is in terms of enhancing their capacity, as well as helping them achieve PCMH, which is a patient-centered medical home status. In addition, we're doing a lot of health literacy or community asset mapping with them, helping the health departments with their public health improvement plans, and achieving FAB accreditation. We also have a media and communications division, as well as a research and evaluation division that complements all of the work that we do. So I'm going to talk to you a little bit about, I have no time. Okay, Well, I'll just tell you a little bit about the campaign, the Louisiana campaign for tobacco-free living, and I'll show you a site and we'll move on. We have a lot of different components. We reached youth. Someone mentioned youth earlier. We work with, in our Fresh Campus initiative, with colleges and universities. We work with musicians and service industry employees. And also we have a Communities of Color network. TFL, as it's referred to, was funded by the cigarette excise tax. We have one of the lowest cigarette excise tax at 36 cents. So this campaign is targeted at policy, prevention, and education at all levels. So it's pretty comprehensive. And these are just some of the programs that we work on to get there. And I wanted to show you the website that is a part of our multimedia campaign. And so this is how we targeted musicians and service industry employees. The only people who are not protected by our smoke-free air are those who work in restaurants where, with a bar in it. So the Smoke-Free Air Act only covers restaurants that only serve food. If there's a bar, you can smoke outdoors. And in some bars, most bars, if they don't serve food, you can smoke. Also, musicians who play in these bars are inhaling the smoke. So our media campaigns are targeted to that population. So we work with our Cultural Economy Foundation. We work with anyone who can get involved in advocating for us so that we can enact policy. And the good thing about a public health institute as a nonprofit, we are able to do a little bit more than a governmental entity in that we can advocate. We can't lobby, but we can almost touch the rim by going to speak with our legislators about policies that we want to enforce. So I won't take up too much time, more time, but just a little more. We have other speakers. Okay, all right, I'm sorry. But we also have programs in HIV, patient-centered medical homes to get men re-engaged in healthcare. And if you have any questions, I'll speak to you afterwards.